Hey everyone, Dr. Josh Matson here. I'm going to talk about colic. We have a lot of infants that come in that have colic issues. They're screaming all the time and like in excessive amounts where they're not just upset, but they are just, they are really upset, screaming all day long, hours on end. And I'm going to talk about what we do to help those kids. So there's a few different movement things that kids should develop in the first months of life, and a lot of times and they use reflexes to help them develop movement appropriately, and a lot of times they don't develop that well. So the most common thing you see with kids that have colic, a lot of times you find kids that have colic, a lot of times they'll have spitting up issues as well, but that's besides the point here. Kids that have colic, a lot of times they have severe restrictions in their neck. So if you take a baby, this is my Mickey baby. If you take a baby, you should be able to turn their head all the way to their shoulder with absolutely no restriction at all. It should just move nice and smoothly. And actually, normal range of motion in an infant is like 100 and some degrees or something like that. It's past their shoulder. So I would say they should be able to go to their shoulder extremely easy with no restrictions at all when you do that. What you will find in almost every kid that has colic is they can't turn their head. You will literally try to start turning their head and they will go like 10, 20 degrees and it gets so tight that they literally can't do it. It's really pretty wild. But that movement is super, super important for them to develop the musculature of their neck, for them to activate what are called mechanoreceptors in their neck, which give their brain information about where they are in space. And typically, if they can't move their neck, there's probably because they're in pain. They have there's so many receptors in the top of the neck that give you information, and they're probably really uncomfortable. It's probably why they're crying all the time. So that's what you'll see they literally cannot turn their necks at all. It's really quite weird. So you'll lay them on their back, start turning their head, and it should turn really smoothly both ways. If they can't do that, that's a big problem. Most common reason why. Upper part of the neck, you have the very top vertebrae. It's called your C1 vertebrae, also known as your atlas. It typically is not functioning very well. There's a lot of studies out there that show that infants, between 80 to 90% of infants that are born during a normal, natural vaginal birth have dysfunctions in the upper part of their neck. It's so common. But what that does is it alters the ability for them to gain that good range of motion and allow them to move appropriately. And that's by far the most common thing that you see. And that movement is super important for them to develop a reflex. It's called a primitive reflex called an asymmetrical tonic neck reflex, which allows them to move fully through their full ranges of motion. When you get their neck moving the way that it should in the correct ranges of motion, their colic symptoms improve dramatically. And it's really, really cool to see. But it usually only takes literally a week to get that change to happen because they're so young, and it's really easy. So if you have a kid and you know a kid that's really struggling, this is probably one of the easiest things to help in our office. So, send that to a parent if they're struggling because it really is a pretty simple solution. So hope you guys have an awesome day. Patients are here. Have a good one.